Today, we're talking about something really serious, a condition called anencephaly. It's a severe birth defect, but here's the thing. Understanding it is the first real step toward preventing it. So we're going to approach this with a lot of care, focusing on what the science tells us and, most importantly, on what can actually be done.
But you know what? Let's kick things off with a pretty powerful and hopeful idea. What if I told you that one of the most severe birth defects out there could often be prevented? And sometimes this can happen even before a woman realizes she's pregnant. That possibility, well, that's really at the heart of our entire explainer today.
All right, so here's our game plan. We're going to break this all down into 5 clear parts. First, we'll cover what anencephaly actually is. Then, we'll get into how and why it happens. We'll look at diagnosis, face the tough reality of treatment, and then we'll land on the most crucial part, prevention.
So first things first, what exactly are we talking about when we say anencephaly?
Okay, so anencephaly is a very serious birth defect where a baby is born without parts of its brain and skull. It belongs to a group of conditions called neural tube defects, or NTDs. Now, this neural tube is basically the earliest building block for what will become the baby's brain and spinal cord.
And that brings us right to our next question. How does something like this even happen? You know, to really get what goes wrong, we first have to understand what's supposed to happen in those very early days of development. In the very first weeks of a pregnancy, there's this flat little plate of cells. And what it does is it starts to fold in on itself. Think of it like a piece of paper that's rolling up to become a tube. That's the neural tube. And it closes up almost exactly like a zipper. Now, the final step here is where the magic happens. The very top of that tube is designed to become the brain, while the bottom part becomes the spinal cord.
And this right here is the whole story. In normal development, that zipper zips up all the way to the top, no problem. But with anencephaly, the top part of that neural tube, it just fails to close. That one single event, that failure, is what stops the major parts of the brain, like the forebrain and cerebrum, which handle thinking and moving, from ever developing. And the skull can't form over them either. Now get this. This entire process, this incredibly important closing of the neural tube, it all happens between day 23 and day 28 after conception. We're talking about a tiny 5-day window in the very first month. And almost always this is happening before a woman has any clue that she's even pregnant. This timing, right here, is why planning ahead is just so important.
So what causes that zipper to fail? Well, the honest truth is, a lot of the time, the exact cause is a mystery. But researchers have pinpointed several things that can increase the risk. Sure, it can be genetic, but it's often a mix of things. At the top of that list is a lack of certain nutrients, especially folic acid. Other things that can play a role are uncontrolled diabetes or obesity, getting a really high fever, and even using certain medication. Okay, so now we know how this happens developmentally. Let's move on to what the signs are and how doctors are able to diagnose anencephaly. The physical signs in a newborn are pretty clear right away. There are parts of the skull missing, and you can tell that large parts of the brain are absent. And because those key parts of the brain never developed, the infant is born unconscious. They can't see or hear or feel pain. You might also see other issues like folded ears or problems with the heart. The good news, if we can call it that, is that this condition can be diagnosed with a high degree of certainty during pregnancy. A routine blood test, for example, can show really high levels of a protein that acts as a major red flag. But a standard ultrasound is usually how it's confirmed, because the person doing the scan can literally see the missing skull and brain structures. Other tests, like an amniocentesis or an MRI, can give even more detail. This brings us to what is, without a doubt, the most difficult part of this explainer. We need to talk about the reality of this condition and what the options are for treatment. Let's just be very direct about this. There is no cure for anencephaly. There's no treatment. Because the brain doesn't develop in the first place, there's nothing that can be done to fix or reverse it. And sadly, this means the prognosis is absolutely devastating. As you see here, in about 75% of all cases, the pregnancy will end in a stillbirth. For the small percentage of infants who are born alive, their survival is tragically short, usually just a few hours or at most a few days. The medical care they receive isn't meant to cure them. It's what we call supportive or palliative care. It's all about making sure they're warm and comfortable for the brief time they have. And that is exactly why we are now pivoting to the single most important and honestly most hopeful part of this whole conversation, prevention. Because while we cannot treat anencephaly, we can take really powerful steps to stop it from happening in the first place.
The simple phrase really says it all. When we're talking about neural tube defects like anencephaly, prevention isn't just one of the options, it is the only effective strategy we've got. So what is it? What's the single most important tool we have in our prevention toolkit? What's the one nutrient that plays the absolute starring role? It's folic acid, which you might also know as vitamin B9. This nutrient is an absolute powerhouse for cell growth and development. But its most critical mission in an early pregnancy is making sure that neural tube we talked about zips up completely and correctly.
So how much does it take? The magic number, recommended by doctors all over the world, is 400 micrograms of folic acid every single day for any woman who could become pregnant. And remember, because that neural tube closes so incredibly early, it is vital to start taking it before you even start trying to conceive, and to keep taking it through those first crucial weeks. Now, folic acid is the undisputed superstar here, but other things definitely matter too. Getting conditions like diabetes under control before pregnancy, talking to a doctor about your medications, treating fevers right away, and avoiding things like hot tubs that can raise your body temperature. All of these things help lower the risk. And of course, eating a diet full of natural folate from things like leafy greens and beans, that's always a winning strategy.
We've covered a lot of really tough but incredibly vital information today. The knowledge that a simple daily vitamin can prevent such a devastating condition, that is unbelievably powerful. So the last question I have isn't for me to answer, it's for you. Who in your life needs to hear this? Because sharing this knowledge could truly make all the difference in the world.